Around mid-November of 2018, I had a cold, just seemed to be starting. A lot of the symptoms just wouldn't go away. Cough, discomfort in my chest, and they just became greater. Had seen numerous doctors numerous times. None of the things that they ever prescribed me really worked. Cancer wasn't a thought until they sat down on the bed next to me in the ER and told me that I most likely had cancer. About a month before my symptoms started, I had started a new job. As the symptoms were progressing, my direct manager was kind of thrown back, like telling me, you can't get through a sentence without coughing or clearing your throat or stopping. I was equating my coughing daily to 200 to 300 times a day. January 31st, 2019, did a telehealth appointment. That telehealth appointment was a little eye-opening for my wife and myself. I explained to him the different symptoms that I was experiencing and how things were progressing. He was afraid that I may have had a minor heart attack. So at that point, we understood the severity of what we were experiencing, and at that point, we decided to go to the hospital. The biggest thing that they saw was a mass in my chest at the bottom of my mediastinum, where it splits off to either side of my lungs. Pretty quickly, we had an appointment after leaving the hospital the following week. We were able to get a bronchoscopy. So it was February 12th, first time I heard really the term non-small cell lung cancer. We had heard lung cancer being an option, but non-small cell was the diagnosis that we had received at least stage 3. They said, you have a biomarker or a driver behind your cancer, and it's called ALK positive. I was very fortunate to have my wife with me, asking great questions, constantly taking notes. We started to understand how the cancer worked, what the best treatment options were. At that point, they thought it would be a great idea to meet with the #1 doctor in the world for my type of cancer. Really specifically being the biomarker, the driver, ALK positive. Meeting with her, she confirmed the treatment that I was receiving at that point, which was radiation and starting a targeted therapy. She assured me, this isn't the first time that we've given someone this type of diagnosis, and I just want to let you know there's drugs out there that will work really well for you. When my radiation was complete, I started an oral therapy. I've been on this targeted therapy for just over 6 years, and it's been keeping my cancer stable. My treatment has given me a second chance at life. And it's taught me to never take anything for granted. The relationships that I have, being a dad, being a husband, being a friend, coach both my girls' soccer teams, makes every moment that much more important. My wife knows my favorite type of cake, and every year the girls look forward to blessing me with that cake. That's something that's very special for me as we're celebrating life. I feel like now, the more I share my story, the more wisdom I gain, the more that I'm learning of how to attack my cancer. The way that I live my life or my perspective is helpful for others. That is what will continue to carry me through my diagnosis and give me purpose.